because this is what is going to take most of the time, most of the points in uh, this particular lecture. The first important thing is to have a pre-hospital care. What exactly we are going to do before the patient reaches to the hospital? Because to prevent complication, we require to start the treatment as soon as possible before the patient reaches to the hospital. So first important, because the most important cause of death क्या है? Is a fluid loss. Because of the burns surface area, total body surface area, जितना भी percent involved है. Normally, if it is more than 50% of the body surface area, if it is involved, then the fluid loss can lead to hypovolemic shock. Because of that, we require to take care of this as soon as possible. So before even patient reaches to the hospital, first important point we should consider is start the IV fluids. Take a good IV line as soon as possible. Why? Because when the patient starts leaking plasma, patient का blood pressure starts dropping, and when the blood pressure starts dropping, it may have a difficulty in taking the IV line. So as soon as possible, take a good IV line and start the IV fluids before even patient reaches to the hospital. कितना fluid देना चाहिए? Usually what we can start with is a Ringer's lactate or whichever crystalloid that is available. As much as 125 ml, that's what is the formula. Exact formula is different, but we can start as soon as possible. 125 ml per hour of Ringer's lactate to all patients need to be started as soon as possible. Of course, the exact fluid requirement can be calculated with the help of a formula which I'm going to talk about in the proper management, in the hospital management. ये hospital में पहुँचने से पहले patient has to be started with the IV fluids as soon as possible. Patient reaches to the hospital, उसके बाद हम लोग exact calculate करेंगे कि कितना IV fluid लगने वाला है with the help of the formula. Second important point what we need to consider before patient reaches to the hospital is remove all the clothing, because it is a possibility that the tags of the clothing can get trapped into the dead tissues and can create a foreign body, can get lodged into the tissues which can create complications. जो भी clothing है को remove करो. We can also, if it is possible, to give injection morphine to reduce anxiety, to reduce pain if it is superficial burns. अगर हम लोग दे सकते हैं then it is okay. Otherwise any other painkiller can also be given. So these are all important points we should consider before the patient reaches to the hospital. IV fluid start करो, IV line ले लो and give painkiller, remove the clothing, and as soon as possible shift the patient to hospital. Now when the patient reaches to the hospital, now there is something called as hospital care.